We're ready.
All right. Well, we'll go ahead and get started. Thanks everybody for joining us on a stormy Friday. And I know we have a number of new board members joining us today. So welcome to all of you. And so maybe Dizzy, I'll let you do some of the announcements, and I'm not sure if we're do you want to welcome the new board members? I can't see them since I'm dialed in on the phone, but if you can let us know who is all on the line and then run through your announcements before we go through the approval of the minutes from last meeting. Does that work, Dizzy?
Sure.
Okay, perfect.
So you want me to start with who I see for introduction? Sorry, I had Suzanne talking at the same time.
Yes, that would be great.
Okay.
I know we got a number of new members.
Yes, so we would like to welcome Tracy Newman. So we just kind of found out, I think that was yesterday, I believe you took Robin Nelson's place from the Fargo School Board representative. So welcome to you. We have Kayla Nelson, who is not new, but fairly new, that she has joined us a couple times now. We have Amy Lavalis, so she's a couple times new as well. Bernie Dardis, who is with us, he is replacing Mike Thorstead from our West Fargo representative, so this will be his first meeting. And then we have Lynn Telford. Of course, she's been an old timer with us. And then I believe the rest is mainly our management team that is on. And then we have Arlette Preston. She's our new health liaison for the city commission. So she is joining us as well. We have Dr. Lako on by phone. Let me see if I'm missing anybody. Did I miss anybody? I think I have.
This is Pearl Ferguson from Cass County Human Services. I'm here as well.
Oh, great. Thanks, Pearl. So yes, Pearl would be, so Chip Ammerman was kind of our Cass County member at large. So Pearl will be replacing Chip. So welcome everyone. I appreciate your willingness to do this, and thanks for putting up with our new virtual lifestyle. If anyone has questions about, for the new members, we would have a binder available that has some information just on kind of our Board of Health, how it works and what the expectations are. So we'll be getting those to the new folks if you don't have that yet. But please, after looking at that, if you have questions or comments, anything like that, please be sure to reach out. Other than that, I don't know. I didn't have any other announcements for today unless anyone from the group does.
Okay. Well, thanks, Desi, for running through who's on, and welcome everybody that has joined us. So excited to have a lot of new members on board. That's fantastic. So if there's no other announcements, we'll move on to approval of the meeting minutes from our May 28th meeting. That was attached to the invite. I know many of you probably were not on the prior to that, so just more of a awareness of the content, but I'd entertain a motion to approve the minutes from May.
I actually have an adjustment to that on the minute. This is Amy Lavala speaking. It says that I was absent. I was there, but I arrived late.
Okay.
I didn't see anything else though.
Okay. Entertain a motion to approve with that edit in place.
Motion.
Thank you. Can I get a second?
This is Lynn Telford. I'll second.
Perfect. Any discussion? All those in favor say aye.
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 Aye. All right. Motion carries. Thank you all. All right, Desi, I think you're up next with COVID-19 updates. A lot going on there, so.
Yeah, so obviously we spent a portion of our last meeting as well, just talking about kind of where we're at with things. What I thought we'd do today, we'll just kind of do it informally, but I thought I would give each of our management staff that are involved in the COVID response just a time to kind of share what their responsibilities have been. They kind of have different pieces of that response. So, and we're trying to get everybody fixed. We did have a couple with technical difficulties. So, Holly's not on. Holly's our PIO, so I will just say that she is our communications specialist. So a lot of our activities through this have been, you know, messaging, social media, trying to kind of monitor what's being put out, try to identify misinformation so that we can counteract that. Obviously, the state we were planning with our task force to put out a marketing campaign on masking, and the state put out a campaign last week, which we weren't really aware that was coming out. So that caught us a little bit off guard. So it kind of derailed our plans on what we were doing. So we've had to shift gears a little bit. So we are going to, they have the hashtag MaskUpND. So we are going to kind of take that and then do some local flair with that and do a marketing campaign around that just to help. You know, we know that masking along with those other prevention measures are going to be really important in this next little bit until, you know, we can start hopefully getting a viable vaccine around. But so we just needed a campaign to kind of help people know the importance of that and to kind of help with that social norm to change the culture and to get people to be more socially accepting of the whole masking campaign. So we will be doing that. Otherwise, we've done some education in the community we've translated some materials for various cultural groups just to help kind of with some of that health information, just what they need to do to protect themselves, you know, what happens if they have COVID, you know, the whole isolation and quarantine, all of those, just to do some simple messaging. We used the Ashara group and some of the other cultural groups in town to get that disseminated out. So that was kind of one of our larger missions in the beginning. Melissa is on vacation, but of course she manages the budget in this whole piece. And so we were allocated some local public health dollars for funding. And then we have the COVID task force. We have some funding in that. So those are kind of the two pots of money that we have been able to draw some of our costs from. It's been challenging for her just to know like what qualifies, what doesn't. So that's kind of a daily learning process, I think, for her. So we've worked hard to kind of make those definitions of things that are acceptable to bill out and things that aren't. So that's kind of a daily struggle. But I don't think Doug was ever, Doug, were you able to get on? I see his name, but I don't hear his voice. So we'll start. Larry, maybe I can have you start and talk about the whole, the contact tracing efforts, because that, after when the task force was formed, of course, one of our main missions in the beginning was to develop a targeted testing strategy so that we could identify positive cases. And knowing that then when we identified those positive cases that we needed a strong contact tracing team then to follow up so that we could educate folks, so that we could appropriately isolate those that were positive, that we could quarantine those close contacts, and so we could slow the spread that way. So Larry has been managing the contact tracing team, and so I will just let him speak a little bit on some of those efforts and where we are at in our county with that.
Okay, thank you, Desi. First off, I want to welcome all the new Board of Health members. My name is Larry Annenson. I am the Director of Health Protection and Promotion at Fargo-Cass Public Health. And during this COVID-19 pandemic, I serve as the Section Planning Chief, and part of my responsibilities have been overseeing the contact tracing group. Contact tracing has been around for decades, and state public health and local public health units use contact tracing to help slow the spread of disease, and it has helped slow the spread of COVID-19. And currently, we have approximately 15 individuals who are on our contact tracing team. It's very fluid. We, at one time, I think we've had up to 36 or 37 individuals when we had a significant larger number of positive COVID-19 cases in Cass County. And as staff transition back to their regular duties, such as school nursing and other roles, we've been onboarding other staff. We have been advertising, interviewing, checking references, and adding staff. A big key of contact tracing is watching the numbers, looking at the workload, and following trends. In contact tracing, I think it's important that people realize that they follow guidelines through the North Dakota Department of Health. We work very closely with our 2 field epidemiologists, and they sometimes have to notify individuals and give them their results, and find out who they've been in contact with a couple days prior to symptom onset, or if they are asymptomatic or do not have symptoms, they ask 2 days prior to them testing who they've been around. And a big part of what they do as well is just building rapport, because it is a stranger reaching out to them, calling them, providing education, letting them know, risk and what exactly is a close contact, what's not a close contact. So they are doing just an outstanding job with that and building rapport with individuals. Ideally, they like to monitor symptoms and check in with them daily. They either do that over the phone or by survey. There's online surveys that get sent to individuals. They help educate them on how long they should self-isolate if they are positive for COVID, or if they're a close contact, how long they should quarantine and be at their home. Another important fact is that our contact tracers work 7 days a week. They work 9 a.m. to 7:30 p.m. In our call center at Fargo-Cass Public Health. Other areas throughout the state, some of the contact tracers work from home. We're one of the few that actually have a call center right on site, which we find being extremely valuable in relationship to orientation, training, and continuing to provide good quality contact tracing within Cass County. And with that, I'm open for questions related to contact tracing.
Thanks, Larry. Do you have any questions?
Okay, thanks, Larry. I don't know, I'll do a check again with Doug to see if he was able to get on. If not, I will probably just do his portion.
Yes.
Oh, perfect.
Yes, sorry, I was on the phone. I don't know. Can you guys see me? Desi, can you see me? I see you.
I can't see you, but I can hear you.
Okay, well, that's good enough.
No, I see you.
All right. All right, good afternoon, everybody. So my role is, I would like to say it's the catch-all or whatever, but I know that Suzanne is here long before me in the morning and long after the day that I leave. So logistics is what we do in operations. So everything from a facility requesting to be tested. So we've been testing the long-term care facilities in Cass County and Clay County each week. So it's staff and residents. And we go to the facilities for their residents and do the quality assurance with the electronic system that they're now using. But for the most part, they test their residents. So a nurse working in a nursing home tests their residents, but then their staff come through one of our static sites. We used to have 2 schools. We now move 1 school here in Fargo, 1 in West Fargo, Liberty, and then Discovery. We've moved those out of those parking lots so that we could let those schools have their parking lots back. We now have Roll Farms. That is where our static site is Monday through Friday, 8 to 5. It is not public testing. It is scheduled testing for each nursing home at a specific time and day. It is also the makeup site. So if an employee is on vacation or can't make it at that time, then they would go through that site. And then also the would-be visitors to allow somebody to go in, see. So if your spouse or your loved one is in a nursing home, the requirement on from the nursing home is that you be tested, so then they go through there. So we do also the logistics, getting all the swab kits to and from Bismarck to the lab or to the outsourced lab Mako. Quality assurance, making sure that what swabs go out come back in. All the PPE, we get a trailer load of PPE each week from the medical cache. Teresa Steiner in our office does a whole lot of buying of stuff for us, whether it's it's stuff, you name it, because we have to supply the entities not only here in Fargo but for the region. I don't know, I'm in a lot of meetings. I get a lot of complaints. We've had nurses beat up. We've had them spit at. We've had all kinds of stuff. I have a 0 tolerance. So then I reach back to the nursing home and say, these people went through today and they did this. They're no longer allowed through our site. They're your responsibility to be tested now. Nobody's fought back because this is a criminal action, and I do have zero. I've told Desi, I said, you can either support me or not support me, but this is insane that this continues to happen each week and with each site. You would not believe how much of my time is spent with that. But so that is happening. Other than that, we have NDSU next week. So that is university students, staff, and employees. It's also anybody in the university system. So let's say you live here and you go to Mayville or you go to UND, we're not turning anybody away. It's a test is a test, whether you take it here or there. So that's going to be a very large 6-day event that we're doing, and we're got an all call out for the guard and for nurses. It's going to be a very large event. It will be the largest event times 6 days that we have done in Eclutchen in North Dakota. So it's a huge event, but keep in mind, we are still doing the 2,000 other tests here in Cass County with that. So it's a large amount of tests that we are doing. That is it, Desi. I could ramble on.
And just so this group is aware, obviously the higher ed testing was not our idea. For us, it's a whole lot of work, a whole lot of kids, and it's going to be a point in time testing. So I don't know the value of that, but that was the governor directive. So we were basically just told that was going to be happening. So it's been a struggle. I think initially we were told it wasn't going to involve us. And now that it's starting next week, we've been told this week that it's involving us. And so that's probably why we all seem a little bit scattered. We're just trying to maintain with what we have. It's been a really difficult thing being the largest county, and because we had the most cases right away and we've been at this effort since the middle of March, it's been a really difficult transition to kind of have the rest of the state join in late, and then someone at the state level tries to change processes that have been working here for a long time, and it's just really, it causes a lot of extra work for us. So, but from the testing, yes, we have our testing matrix that we use, that we have we developed early on with the task force that we picked our priority groups that we thought we would get kind of the most bang for our buck on our testing supplies, knowing that we don't have unlimited testing supplies within the state. And we are trying to be very good stewards of those testing supplies. That being said, it makes a lot of people in the public not very happy when they just randomly want to be tested. And it also doesn't help when across the state, they are continue to just do mass testing. So we have dug in our heels pretty good here to try to maintain that targeted testing. So of course the higher ed testing is throwing us off a little bit, but like I said, we will do the best we can with trying to get that done. We can't do it alone, so we've had to request support from the state, and still really don't know how that's going to turn out next week. So,
Debbie, this is Lynn Telford. I have a quick question. I hope you can hear me okay. So,
yes.
Is there anything the board can do to support you guys, since we are the largest county, largest public health department, and you getting the directives from the state that conflict with the approach that you guys have had to take as serving the largest public health area?
Yeah,
is there anything we can do?
I will keep you posted on that. I will let you know that we have a meeting this afternoon, kind of because we've pushed for this meeting. At some point, they meaning the state, determined that this response was going to be a regional approach. And we knew that, like, for the logistics part of it, Doug has handled it for Cass County, but then did agree to take on logistics for the region. Well, that has somehow morphed into that we are just taking on the region for everything, but they neglected to tell any of us that. So we have a meeting today because, you know, you just can't take the largest health department, the largest county, and then add more duties on to people that can't keep up with the duties they have. So we have a meeting with Dr. Stahl, who's the state health officer, and then a couple other, Tammy Miller from the governor's office, and a couple other head state people, just to say, you know, I think sometimes their answer is to just use our COVID funds. Well, all the money in the world doesn't make more of me or make more of Suzanne or make, you know, it's like we can only be stretched so far. And even if we would hire people, it's still the same core group of people that would need to hire and supervise and train. And so it's just trying to get across to them our limitations. And, you know, many of us have been working well over our standard hours since March. Doug's been working over his hours since January. It's just trying to get them to recognize, you know, when we can't handle it. And I think if we just had Cass County, we are fine. We have a great process. We have great staff. But to try to expand us to regional is just not even realistic. And so if push comes to shove and I need a little backing, I will, you know, and the mayor's been really good too. He is co-chair on the task force with me. And so he tends to help us push back a little bit when he knows that we are doing what we can locally and can't do anymore. So he helps as well. But if there is some kind of statement or something that would help from the board, I will certainly reach out and let you know. Appreciate that.
This is Dr. Newman. Can I? Oh, sorry. Sorry. I just have a quick question, Desi. Can you just explain super quickly what is going to be going on with the testing for academics and back to school?
Well, at this time, so all of this was arranged with the governor's office and the North Dakota University system. So the plan is basically at this time just for higher ed. And it was for faculty, students, and staff. And at this point, it's like a one-time thing. Although they are doing some of their student athletes a little more frequently, because that's like an NCAA requirement, I think, is how that worked. But there is no plans at this point to do any public schools. So it's, like I said, just higher ed at this point. And Doug tells me that the only lab that's available for this group is the nasal swab. So for those of you that don't know, there's an oral swab and a nasal swab, and the oral swab is much preferred over the nasal swab. And so Doug's projecting that once the college students hear that it's a nasal swab, that it probably may not be as well attended as it might have been. So we'll have to see if that holds true. But yeah, that's the plan for right now, is just to do that across North Dakota. And Minnesota had no plans for higher ed testing, but because we are, the task force is kind of a metro approach for Fargo and Moorhead. So those Moorhead college students can come to some of those North Dakota sites for testing.
And are you doing it at a certain location where they can come certain days? Is it set up pretty specifically?
Yes. So Doug, you have that. That's at NDSU next week, 18th through it's 6 days, starting the 18th.
Okay.
Yep, it is Tuesday through Sunday, 10 a.m. to 4:30 p.m. We close the gate at 4:30. If there's 5 cars in line, we'll test them. If there's 100 cars in line, but we close the gate at 4:30. It is going to be at the Fargo Dome parking lot because we need a mass amount of people. It was going to be in the Shack parking lot, which is a very, very small parking lot. And egress and ingress is from University Avenue, and that's not acceptable to have 2,000 cars coming and going off of University, especially if you were just swabbed. So we're back at the Fargo Dome where we've had the other sites, but keep in mind our largest day there was only about 1,400 swabs, and we need to do 2,000 each day. So we're at Fargo Dome, but it's not going to be publicized. It's not going to be announced. NDSU has pushed it out through their system. It's no different than us going to a nursing home to do their testing. This is for that group. But then again, we are not going to turn somebody away, or if somebody showed up and they said they were, 80-year-old NDSU student. Well, then that's fine. Come on through.
Okay, and you do have support from the state for staff.
Well, that has been lots of my late night. Yes, I've met with the general and the State Emergency Operations Center and the governor's office, and I said, we cannot do this. This is 80 people just to facilitate that, and 20 nurses. Keep in mind, we're not doing any less testing than we're already doing. We're already doing about 12,000 or 2,000 tests every day. I need additional people. And so sometimes when you are asking, what can you guys do, is to paint that picture to the others that we are not a small town. We have a lot of population here. That takes a huge amount of people to do that. So right now, I met with the general yesterday morning, and he is working to reassign people and extend. With all the ambulance services. For example, if we had a flood, they would come here and help us evacuate. So those are all being deployed.
Thank you.
And this is Lynn Telford again. Is it mandatory for the students to return to school to be tested? So I'm not sure the point,
No.
But I guess they're just offering it to the students.
You are correct. Not our decision. It is not required. You feel how I feel.
This is Dr. Newman. I just want to add, they can get this test anywhere, correct? It doesn't have to be through public health. Hello?
So, yeah, I don't know that it's being offered to them. It's not a requirement.
Okay, I mean, just because
Stanford,
I work here at Stanford, and we are currently running 3,000 tests a day. So I don't know if that helps, if they can go anywhere.
Where at Stanford are you doing 3,000? In Fargo or corporate wide?
I think that's an enterprise number, but
Yeah, that's probably an enterprise number. It's not in Fargo, but I will tell you, many of my calls per day are because they've gone to their medical provider and they're asymptomatic, but they want to test and they'll get turned away. So that is with both hospital systems. So this is just being
sorry, I just meant in this specific, if it's helpful for college students that they could go other places, correct? Not just.
This is
And then can I ask one more question? What
Samples weren't
turnaround
tested
time are you
for
guys
competency.
using for these screening tests? How quickly will they get them back?
That is a Suzanne question if she is on.
This is
I don't
Chelsea.
see her.
Lots of good questions. As I understand it, I would imagine that some of the college student testing is dependent on, from a financial perspective, so Stanford's only going to do symptomatic people likely and bill insurance for that, and the rest would be under the public health umbrella, would be my guess. So I don't know if a college student going to Stanford, or essentially like you were saying, Doug, is going to be able to get the test. They're likely going to have to go through this avenue, the way I understand it. But other questions for Doug and Debbie?
Yes, this is Bernie Dardis. We continue to talk about higher education. Is there any testing plan for K through 12 for staff or the teachers and custodians and all that on our restart for public schools or private schools?
It's a good question. Desi, are you aware of the K through 12?
I think we lost Desi, and I see her going into Lori's office. So just bear with us with the technology, but I do see Desi coming back on.
This is Lynn, and they did mention earlier that public health is not going to be testing the K through 12 like they will be for higher ed, right, Doug?
That is my understanding, although I do not make those decisions. If the decision is made to test, we try to make that happen. But it's already beyond our control, as Desi has said. I mean, there's only so many hours in a day and so many people.
I can speak to public schools. Oh, excuse me.
No, go ahead, Tracy. I was just going to say I lost my connection, so I had to come run into another office. So you just go right ahead.
Oh, no, I was just trying to be helpful. I sit on the COVID committee for Fargo Public Schools, where we reassess every 2 weeks. At this time, there is no plan for mass testing for either students or staff, at least at Fargo.
And I think that's what Tammy Miller from the governor's office had said too. So that's kind of just where we're at with it right now.
How can they possibly consider sending the children back to school without testing the staff? How can that even be part of the discussion? Because our public is split about 50 on this thing, and they're going to not have any confidence if they don't know the instructors or the custodians or the bus drivers have been tested.
But I think, Bernie, it goes back to that same argument. Like, it will say that they're not infectious that day, but even if someone tests, they could have been exposed 2 days prior, and it doesn't show up on a test yet. I mean, the tests sometimes are kind of a false sense of security too. I mean, I think we're best to lean on those prevention things that we know are helpful. And kind of just assume that everyone's infectious. That's kind of what we do at public health. So, but I just don't know that, because there's not unlimited testing. I know that even Stanford again is prioritizing their testing because there just isn't tests available for everybody that would need to be tested.
I understand that, but the conversation for the last 2 months is that we have to do everything we can, and you and public health have certainly done that, in order to safeguard that our population and the infection rate is at a lower level, so we could get back into bricks and mortar schools. And for them to be not testing staff at least, and I understand the children's age groups and the infection rate is different for the young people, but the Fargo Public Schools, 1/10, 1,300 plus students aren't going to get sent back to school because the parents aren't confident in what they're doing. The only way you're going to build that confidence back up is if you're sending them to a health.
And that, like I said, that may change too. They may end up doing that. I know they have been getting pressure.
But that's where the masks come in. So if you're masked and have goggles or eyeglasses or whatever on, and the other person is masked, it's almost a 0% transmissible rate. So that's really where the masks and the PPE come into play. So, and all the teachers will be masked and probably have face shields or eye goggles or something on. So.
And we have to remember that this is a point in time testing. We would have to test those teachers and staff every week, at least, maybe even more often, because that means that they were negative at that point. They could have already been infectious and be contagious. So it's a tough battle.
And our team has been working with the schools to develop, kind of their plans, to give recommendations and guidance. Dr. Newman, I see you asked if the schools are doing symptom checks. I think they decided to not do symptom checks, if I remember from, because the CDC had come out with a recommendation that symptom checks weren't needed. And so I think the disease control had already developed a tool, but what they're going to do is they're going to share it as a parent tool so that parents can do that checking at home, but the schools would not be doing that, is what I understood would be the recommendations coming out of disease control at this time.
That is correct.
Grant, do you want to talk just a little bit? I mean, obviously, Chris is one of your staff and he's been working with the schools. So if you could just do a little bit of things that he does, and then if you had businesses call, kind of the things that the environmental health group is doing for COVID response.
Yeah, thanks, Desi. Good afternoon, everyone, and welcome to new board members. Like Desi said, I'm Grant Larson, Director of Environmental Health at Fargo Cass Public Health. And Chris has been our point man. Some of you have seen him, and he's doing a good job of keeping a consistent message and really deciphering the guidelines for different entities across Cass County, whether it's Fargo Marathon to school boards to businesses and everywhere in between. So, we're just trying to help them develop their plans, but we can't approve or deny them or bless off on them. And so what he's done and what we have done as a collective team is to answer any questions we can, to educate using the guidelines and kind of steer them in a direction if they have to find an answer with disease control or other means. So each week we have a call at 1 o'clock here now coming with the business online meeting, and that's a couple different entities to see. We also reach out to businesses if they have 2 or more positive cases of COVID within their walls or their business facility. And then we offer a workplace assessment for them, and where we can go out on site and run through the guidelines and what the state recommends for a workplace assessment for that type of business or facility or entity. We can also line up the testing with those businesses if they so choose via the GARD, the National Guard, and then we put them in touch with GARD, and then we help them facilitate that testing. So recently, or currently, I guess you'd say, we haven't had a lot of business in the businesses, or not a lot of people taking us up on the testing, but we have been very involved, especially Chris, on the schools, and the school plans, because that's on the front of everybody's minds, whether you work at school, you have kids going to school, or it just impacts you, because that almost impacts everybody in some kind of way, shape, or form. So we are trying to develop those plans with disease control, with the schools. And so we're working with them specifically to look at the parameters or guidelines the state has put out, and then mesh those with the school plans, that they have their point of contact within the school system, and really working together as a collaborative team. So that's about it in a nutshell, but I'll try to entertain any questions if you have any.
Thanks, Grant. Any questions for Grant?
And I'm going to circle back to the chat because I just had time to look at it and read some of them to see to make sure we've answered everything. Arlette, I think you had asked about the higher ed and if we would be doing the contact tracing and isolation for that. Yeah. So any cases within Cass County that would be positive cases, we would be doing the contact tracing for that group. That's part of our meeting this afternoon, is going to be talking about the whole results process, which Suzanne will talk about, you know, what that entails for us here. But that's kind of the piece we haven't determined yet, is the actual negative results and the positive results for NDSU. But once they are a positive result, our contact tracing group gets them regardless of who makes that initial call. So, and family health care, as far as that, yes, they are supposed to be, you know, it is supposed to be a specific population that is going there. People that don't have an established provider, or maybe would fit their criteria for going there. We certainly don't want to sell that as anybody and everybody. And I know I've talked to Pat and Caitlin there about how to, you know, how they could kind of screen people so it doesn't turn into a general, you know, population testing, because that's not what we want for them. That's not what they signed up for. So, and I don't know that they get everyone screened out, but I think they've been trying better at that to, you know, make that assumption and send people to their providers. I know the thing that came up this week is Sanford is not able to do any travel related testing. You know, there's lots of places that require testing for travel, and we weren't really hip on doing those, because to us, you know, unless it's essential travel, that again kind of felt like a general population testing thing for us. But now that Sanford does not have the capabilities to do that, we will have to probably take those folks through our static testing site, although we are going to ask if it's essential travel or not, just to try to weed through some of those. So I think I got all of those questions. Anything else before we go on to Suzanne? Okay, you're up, Suzanne.
Okay, good afternoon. So I did finally get on my own computer, so that was a success. I am going to just kind of talk about the results that we have, the resulting process that we've been working on from the beginning of this. We've seen great improvements. We started out with our first Fargo Dome events having triplicate forms that many of them we couldn't read. We were sorting through trying to read phone numbers, addresses, trying to figure out how to serve the population the best we could. We were able to, throughout all of these last 5 months, have come to a point where the registration is primarily done through an app. There are still some paper sites out there, but primarily done through an app that is then digitally put through into the lab system, and does really help, because then of course we don't have the problem of being able to read what was written, the phone numbers. There's still some barriers with that. There we get information with missing digits in the phone numbers, or the email address is not correct. So we still have some issues with that, but it really truly has helped. In the beginning of all of this, we called out every single result that came across our desk. I am the contact for the testing events that have Dr. Lako as the ordering provider in Cass County. And so my phone is available, they say 6 a.m. to 11:30 p.m. The lab calls me with all positive results if it falls within that range. After that range, they then, if it comes in the middle of the night, they call me at 6 a.m. with those. So that's been a little bit challenging sometimes. But we do call out, so then we call out all of those positives. And then we were also calling out all the negatives because people in our, in our community are looking for their results. They get tested not to not get results. And so we called all of them out from the office. Now, about a week and a half ago, we were able to transition to an e-notification system that came from the state. So how that works is that when the state lab gets their results, they'll call the positives to me or whoever the provider is. I'm just basically talking about the stuff that we are handling. They'll call out the positives to myself, and if they're Minnesota positives, I call them to let them know that Minnesota will be working with them, what that process might look like. If they're positives that have been previously positive, been released from isolation, work with contact tracing, I explain that situation to them. And if they are new positives, I call them as well and just explain that somebody will be contacting them from contact tracing, and they should look back to their last couple of days and try to identify who their contacts may be. So when they're called, they will have that information ready. And then after that, we get, so that's the first step of the new notification system is I get those positive calls. The negative calls, once that run is done, get pushed from the lab system into Dynamics. And once it hits Dynamics, which is the software that is through Microsoft 365, then it goes automatically to those individuals who have selected to receive an email or a text message with their results. We then can go in. We just recently got access to be able to do these reports ourselves because we were not getting them in a timely manner. With the help of Maeve, who is located outside my office and helping me a whole bunch in getting this stuff done, we are able to run the reports and find out who did not get notified or who opted out of having that notification process. Then those get called. We do call out them. So on an average day, we're probably calling out 20 people. Then 24 hours later, we run that same report for that same group and identify those that have not accessed their results. So that way, if for some reason they couldn't get them opened correctly or something happened and they still don't know their results, we call them. And so that happens another 24 hours later. It has really streamlined the process. There are still some, the benefits in it is the less staffing hours. We've been able to really reduce that because we've spent every weekend we were here. We have been able, we're still here on the weekends, but it's been much more limited. And the other benefit is, like I said, once it hits Dynamics, it automatically goes out. There are barriers still. Clearly, technology doesn't always function as smoothly as we hope, as evidenced by the fact I couldn't get on here for a half hour. And it's the same way with other softwares as well. And so some people can't get their email to open, or different things that come with that. And some people just don't have access to technology. So that's still a barrier. And then we are still relying, there is still somebody at the state lab who has to take the result, watch for the result to come out of their lab information system and actually push that through to Dynamics before it goes out. So somebody has to be watching for those results to be complete before it can be sent out. So there still is that human component that sometimes can delay process. I will say earlier on, when we had the majority of the cases, we were getting our results quicker. And now as things shifted, it was taking longer. We were running into some unhappy people in the community, and I completely understand. We did our best to get everything out as quickly as we could. We are now with this technology now at our fingertips that we asked for it for quite some time. It took quite some time to actually get the access granted to us. Once we received that, we have been able to get results to people again out much quicker. And so we can definitely see the advantage in that. I'm not sure if I missed anything, Desi, if you want me to touch on anything else, but that's kind of what the process looks like now. And I'm willing to answer any questions that you may have.
Thank you. Any questions? I just have one question. It's probably about a week or two ago, we were talking about where from 2 to 3 days to get back a positive result and 3 to 5 for negative. Is that still the case, or is it gotten better or worse? Sounds like it's gotten better.
It seems to have gotten a bit better currently, but that kind of comes in waves. So I can say today that this week, so today is Friday, we have already finalized everything from Wednesday. So that's fantastic. But I can tell you that next week, that story could be very different. I know I had a situation a couple weeks ago where it was a Thursday testing event, and I received a positive call out late on Monday evening. So there is still those things happening. But something has changed this week anyways that has made this week much better, and we just hope it continues because our community is much happier with being able to get their results quicker. But I also know that it could change, especially as we're taking on higher ed starting a little bit heavier next week. I'm not sure if that will affect what we get.
I think it also depends on the equipment. I know that Sanford, for example, I think got a couple new testing machines a week or so ago. Those were coming back within 24 hours. I mean, those were just like really huge. But we also know that we've had equipment failures at the state, and so that will greatly impact or cause a backlog. So I think when everything's going smoothly and capacity is great, you know, they're trying to kind of space the tests out so that they, because all the tests have to go to the state lab or the ones, you know, Sanford does some internally, but the results have to be, samples have to be driven to Bismarck or flown to Bismarck. And so if, you know, you get all the samples in at one time, that kind of tends to overwhelm the lab. So they're trying to do the courier service so it kind of breaks up those numbers so that the lab can kind of consistently be processing throughout the day so that they don't at any one point have this backlog. So that helps as well. The only last thing that I wanted to bring up.
Go ahead, Desi.
So if nothing else, I'm getting really good exercise. So I've just run back now to my other office because I was frozen on the other screen. So anyway, wanted to talk about vaccine and the fact that North Dakota is a pilot state for vaccine distribution. So Suzanne sat in on a meeting this week with disease control and CDC and lots of other powers that be to kind of talk about the process of vaccine. They have, you know, several vaccines that are now in phase 3 trials that they are, you know, hopeful that one or two will come out as the front runners of those. There are a couple that have extreme cold chain needs. So that will be interesting to see how that plays out. They're hoping that those that have that extreme cold chain, so we're talking like 70 below, that maybe they may have, you know, several hours where they could be at a less stable temperature, so they could be used, you know, taken out of a freezer, and then maybe they can sit for a certain amount of time before giving them. If not, it would be really challenging to get that out with our public health systems. But anyway, they're hopeful. They're shooting, you know, they have said fall perhaps for vaccine, but I think we're thinking that's maybe not necessarily the reality. It probably would be more early 2021. The public health challenge is going to be, they've kind of done some informal surveys, and 40 to 60% of people are not going to be willing to take that vaccine because they think it was fast tracked and all safety measures were skipped. And so that's going to be the challenge with our messaging, is to help people to understand that, you know, the safety portion was not fast tracked. It was the bureaucratic things were fast tracked. So to get people to sign on to that is going to be a challenge, but just so that you know, we have started having those discussions with the state and with the CDC on how that is going to look in our community. Is there any questions? I see we're at 12:59, so let me know if there's any new questions. And I apologize for all the technology issues today.
Any questions for Desi on the vaccine piece at all? Otherwise, Desi, I know I have about a minute left, and there's been a lot of discussion about a mask mandate. I don't know if there's been anything further at least within the city of Fargo and discussions around that, but that might be a 15-minute discussion that we don't want to get into, but.
Well, and actually it's probably not. So we did clarify at the last city commission meeting, so they did a mask directive. It's not a mask mandate, so it's kind of a strong encouragement of using masks when social distancing is not easily done. And so when you're in public spaces, when you're in grocery stores, different things, that's when they would like people to wear their masks, along with those other prevention measures we talked about of the physical distancing, hand washing, staying home when you're sick, all of those things. So that really was the directive put out. We do have, like when you come to our building, we have masks available for the public if they come and they don't have one. And we understand that there are people that can't wear masks or might have some issues with that. So then we just try to employ those other measures of the physical distancing and different things. We try not to deny service based on whether or not that mask is on. We just try to implement other measures. So I think that is where we're at right now with that. I think the commission approved that unanimously. I think Commissioner Strand was the only one that said if our numbers really go wild, then he would want something with a little more teeth. But otherwise, he is satisfied with where this current directive is at.
Thanks for that update as well. So we're at time. Does anybody have any other last minute questions before we adjourn for today? Okay, so our next meeting is October 16th. And again, I appreciate everybody's time today and welcome to all new board members. And Desi, if you could let us know how the meeting goes this afternoon. I echo Lynn's comments, and if there's anything that we can do to help, more than willing to jump in and offer that support. So let us know how it goes.
I will do that. I appreciate it.
All right. Thanks, everyone.
Yes, thank you.
Bye everyone.